Thank you first of all, I would like to thank you about the invitation to be here. It's my second year and I am in this schedule, and I really like that. This year's subjects are really interesting because we can see in our life how they can affect the public health, especially through COVID. So I'm going to discuss about digital healthcare and genomics and their role in public health. I would have a presentation on about 15 minutes, 10 to 15 minutes, and then we may have open floor for questions. So let me tell you, first of all, can you hear me? I just check it.
Yes, we can hear you.
Of course.
Okay, good. So what is telehealth? Which is a new innovation in health, in medicine. Telehealth is the use of digital information and communication technologies, such as computers and mobile devices, to access healthcare services remotely and manage your healthcare. These technologies you use from home or that your doctor uses to improve or support healthcare services. You understand that there are some places where we need to have remote access, especially for people who cannot move, who cannot transport to the doctors. So the innovation of telehealth can solve several problems, several medical problems that can save lives. What is digital healthcare, which is another term? Represents a new way of thinking about healthcare delivery that seeks to leverage the technologies of today to their full extent in providing the best service to patients. Healthcare providers, healthcare administrations and hospitals, professionals can also benefit from innovations that lower hospital operating costs. And we will discuss about how it can lower the hospital operating costs, streamline workflows, provide more timely information to care providers, and enable a higher standard of care for patients. There are several parts about healthcare. There are electronic medical records, which requires all healthcare facilities and hospitals to demonstrate meaningful use of electronic health records. We're trying to establish these electronic medical records in Greece. It has not been started yet, but there is a really important effort on that. There is telemedicine. For example, in the United States, they are offering telemedicine services to their patients. Physicians can follow up with their patients, diagnose certain kind of illnesses, and even write an e-prescription. There are the wearable monitoring devices, which are used remotely. There is a big data analysis, which is really important, especially in the cases of outbreaks. And we have used this data. And of course, this data can be used for example, in order to understand how climate change affects the public health. There is artificial intelligence applications, which plays an increasing role in the way that certain health issues are diagnosed and treated over the next decade. For example, machine learning platforms, developers have been able to teach these applications to detect and identify patterns in medical images. And of course, there are some connected devices. Even risk assessment as a plan has been used lately through digital platforms. Move to the next. So digital healthcare, how technology has improved healthcare. The digital healthcare revolution is already challenging the traditional paradigm of healthcare service delivery, changing the way patients interact and engage with the healthcare system and improving outcomes for patients. As of course you understand, we need to have education, patient education, that's very critical, and of course doctors and medical staff education on this new era. As the healthcare industry continues to adopt digital healthcare technology, patients are poised to be the primary beneficiary of lower costs. There's no other way to do digital healthcare. Our only aim, our only motive will be to the patients to be the primary beneficiary. This is not happen for the doctors, this is not happen for the medical staff, but for the best of the patients. The potential of telehealth, because there are some controversial questions and discussions about why we need that. It has the potential to improve the quality of healthcare and to make it accessible to more people. That's more critical than the first part. Quality of healthcare could be even improved by not using telehealth, but to make it accessible to more people. That's very critical. And if you do that, for example, it will decrease the health inequalities that happens in several countries. Telehealth may provide opportunities to make healthcare more efficient, better coordinated, and closer to home. Think about that we have an old guy who is 80 years old, he cannot move, and he needs medical help. And through this way, we can help him to his health and, of course, to improve his life. Research about telehealth is still relatively new. There are several countries that have not used that yet. Of course, it's growing. Of course, it's costing a little bit at the beginning, but as much as we use it, of course, it will go less expensive. Studies have shown that both telephone-based support and telemonitoring of vital signs of people with heart failure reduce the risk of death and hospitalization for heart failure and improved quality of life. There are some exams, for example, in our area, with the help of these communication companies, and it has been used so far, not extensively, but it can be used and shows very good results. The goals of telehealth, also called e-health or m-health, mobile health, for example, include the following: make healthcare accessible to people who live in rural or isolated communities, make services more readily available or convenient for people with limited mobility, time, or transportation options, provide access to medical specialists, improve communication and coordination of care among members of healthcare team and the patient, and of course provide support for self-management of healthcare. Think about, for example, for mental health. So far, there are so many people who have not access to psychologists or psychiatrists. So through that system, we have already started to establish in some islands, in Greece, for example, some remote mental health units through the help of some non-government companies. So it started to work quite well. For example, let's consider the ways telehealth could help you if you have diabetes. You could do some or all of the following to make it more practical. Use a mobile phone or other device to upload food logs, medications, dosing, and blood sugar levels for review by a nurse who responds electronically. Watch a video on carbohydrate counting and download an application for it to your phone. Use an application to estimate, based on your diet and exercise level, how much insulin you need. Use an online patient portal to see your test results, schedule appointments, request prescription refills, or email your doctor. Order testing supplies and medications online. Get a mobile retinal photo screening at your doctor's office rather than scheduling an appointment with a specialist. Get email, text, or phone reminders when you need a shot or food exam or whatever. That means, of course, there is a requirement for that the person knows how to use all these telehealth access and telehealth facilities. This is the main point, that we need work to be done. Let's go to the next. Patient portal. For example, your primary care clinic may have an online patient portal. So let's think that every hospital could have a patient portal where the patient could access that and find information about his medical problem. This portal could be a more secure online tool to do the following: communicate with your doctor or the nurse directly, request prescription refills, review test results and summaries of previous visits, schedule appointments, or request appointment reminders. Think that even for example, for refugees or for migrants. This could help because through that they can carry by themselves, they can carry their medical health information and show to the doctors, even if they travel different countries. There are some virtual appointments that can be used in telehealth. For example, some clinics may provide virtual appointments that enable you to see your doctor or a nurse via online video conferencing. Through COVID now, it was really helpful if we could have that. We couldn't have that in Greece, but it could be really helpful. But because think that some people could have some symptoms, they don't need to visit the hospital, so they don't need to be under all this risk. So other virtual appointments include web-based visits with a doctor or nurse practitioner. When you log into a web-based service, you are guided through a series of questions. You can ask directly your doctor about medications, about symptoms, whatever. And similarly, a nursing call center is staffed with nurses who use a question and answer format to provide advice for care at home. Virtual appointments, while these services are convenient, they have, of course, drawbacks. There are several drawbacks. Treatment may not be coordinated with your regular doctor. This is a very important drawback you have to keep in mind, because when you have a connection with the doctor, you need to see your own doctor. I mean, you have like a very close contact with him, so you need to meet the same doctor. So this is maybe a very important drawback for this. Essential information from your medical history may not be considered in these appointments. The computer-driven decision-making model may not be optimal if you have a complex medical history. The virtual visit lacks an in-person evaluation, which may hamper accurate diagnosis, and the service does not easily allow for shared doctor-patient decision-making about treatments or making a plan B if an initial treatment does not work. These drawbacks, of course, cannot be, cannot as negative about telehealth, but we can find solution for some of them. The remote monitoring, a variety of technologies enable your doctor or healthcare team to monitor your health remotely. For example, these technologies include web-based or mobile applications for uploading information, such as blood glucose readings to your doctor or healthcare team, devices that measure and wirelessly transmit information such as blood pressure, blood glucose, or lung function, for example, air quality, air quantity, etc. Wearable devices that automatically record and transmit information, such as heart rate, blood glucose. You can see, maybe you have seen such systems, for example, in your mobile phones. For example, we have these health systems that write some health rate, and then you can share with other people, etc. Doctors talking to doctors, that's a very crucial thing about telehealth, because doctors can share experience. Doctors can also take advantage of technology to provide better care for their patients. For example, maybe is a virtual consultation that allows primary care doctors to get input from specialists. If we had this system of the primary care doctors, they can directly ask a specialized doctor for a very specific medical problem. That's really important, because it will give to the patient better quality and more specialized treatment. There are some personal health records that's really important, that we can, from now on, we can collect it and have it from all our life. We can keep it and live and transfer this with us. So think how safe that you may feel if you can have all your medical history with you whenever you travel somewhere else. There are some personal health applications who has been created to help consumers better organize their medical information in one secure place. For example, store personal health information, record vital signs, calculate track caloric intake. I don't know how many of you, for example, have record your heart rate or some glucose information in your mobile phone. I just try to say that we have already started doing that. So think about that. It will be more extensively and more organized. Of course, there are some limitations. While telehealth has potential for better coordinated care, it also runs the risk of fragmenting healthcare. Fragmented care may lead to gaps in care, overuse of medical care, inappropriate use of medications, or unnecessary or overlapping care. If it comes easier to use drugs, then you use it more often. So that's maybe it's a really important limitation. Another thing is the potential benefits of telehealth service may be limited by other factors such as the ability to pay for them. As I told you at the beginning, now it costs. Of course, this will that means that if it costs more, that we have lower and more limited access from the people. Insurance reimbursement for telehealth still varies by state and type of insurance. For example, it's not covered by the national health system so far. Also, some people who would benefit from improved access to care may be limited because of regional internet availability, needs internet, or the cost of mobile devices. Of course, these are severe, these are several limitations. Another thing are some limitations for bioethics. That means that we transfer very personal medical information. So we have to use the GDPR system in order to protect the people for transferring this information. There is big data. The big data, it's a very important part because it can give us the whole an holistic inspection and holistic information for such, for example, for an outbreak, where when we collect this big data needs, for example, big platforms. So we need more advanced technological systems. Digital healthcare makes healthcare convenient for patients. It's a highly competitive industry until today, and is introducing new ways for patients to customize their care and find more convenient options for health services that suit their needs. Healthcare providers can use digital technology to gain a competitive advantage in serving the needs of patients. Patients are the customers of healthcare, and digital healthcare will create new opportunities for patients to exercise their consumer choice in choosing healthcare providers. In practice, for example, in bold letters, you can see two countries who are using some applications. For example, Kyrgyzstan, a safe delivery application provides midwives with guidance to deal with different birth scenarios, including some that may require an emergency response. So they learn through that. Or in Finland, for example, a patient-oriented digital healthcare service known as Health Village was set up by different university hospitals. They established an online platform who enables people to plan and manage their own care using simple medical devices to set readings to health professionals. So it's rather more organized, this digital information. Why now it's priority from now on? The COVID the disease have proved that we need to go further, to go faster in digital health. But in fact can include a range of interventions, including electronic health records, mobile health application for monitoring and prevention, telemedicine, integrated care delivery, clinical decision-making support tools in primary care, robotics, personalized medicine that I'm gonna discuss in a few minutes, nanotechnologies and artificial intelligence. COVID, of course, as I told you, is an accelerator to that. It shows us that we need to go further, to go faster, and go deeper to health medicine, to telemedicine. These digital methods of delivering healthcare are here, and we are very likely stay. The greater leadership and knowledge sharing in this area are important to ensure that individuals are well served and that health systems benefit from new technologies. Of course, if we overcome the problems I already told you. And a few things about genomics and health that's really important, that comes with digital health. I'm working as my work in the lab is molecular epidemiology in some parts, especially in viruses. So I can tell you a few things about how helpful is the genomics. There is a framework to ensure that genomic medicine is provided safely and effectively. It has a number of components. For example, assessment, designation of specific genomic tests to demonstrate validity and clinical utility, assurance of genome testing, workforce development, public education, and of course, there are some ethical things along the others, broader health, etc. Let's see where we are using genome testing. Risk assessment for disease incidents, disease diagnosis, clinical management of diagnosed disease for both intervention effectiveness and safety, and surveillance of disease recurrence. You could see here how we have a new term is not only called genomic medicine, but personalized genomic medicine. So you can see there is this figure shows how all these are all together. That means where we come to patient, how we'll collect information, genotype and phenotype, and how we combine them and then go back with several databases to the patient. But let's move to more easier schemes. This is another scheme which is a little bit complex, shows the way that we have how the information travels from area to area. For example, COVID, we need to know information about COVID genetic material from different countries in order to find the mutations. So we share the information through different areas. For example, we have a mutation from South Africa. So we need to know if this genotype of this mutated virus has traveled to Greece or somewhere else in Europe. So through these databases, we use this information. Surveillance, outbreak, response. So we need to have portable genome sequencing. Sequencing is a very crucial part in the how we deal with outbreaks. And of course, digital epidemiology to One Health. Well, what means One Health here? That means that we share information from genetic material from where this virus, for example, travel from animals to people and between people, etc. Finally, I can show you a few figures about and finalize my presentation. You could see how it could work, how the new information, you could see how we combine the genome, the genetical testing with digital platforms. We collect the information, we find the DNA, RNA, whatever it is, we are doing genome testing, and then we transfer the information through digital platforms, and we share the information between different countries. We can have mobile medical units in the field, in any field we care about that now. You could see how it is in more extensive way. We have the isolated sequencing. That means we find the sequence of the DNA of whatever we are looking. And then through that process, we have comparative analysis and visualization of relationships between, for example, viruses like it is here, and then we try to find where this phylogenetic tree you can see and how viruses spread between people, etc. And this is another way how we have the emergence of infectious diseases between animals, as I have already told you. And finally, genomics and epidemiological surveillance, that's very, very critical from now on. We need to find the connections between the several types. We need to know the genome in order to do that. We need then to upload the genome to platforms and then to discuss and work on that and find the main cause, for example, the first case that started disease, etc. So, by finishing, I can tell you that there is a global alliance for genomics and health. There is a framework for genomic data sharing. Of course, we need to care about ethics, bioethics, that's really important, but we can use that. The elements of this framework include the following: transparency, accountability, engagement, quality and security, risk-benefit analysis, recognition and attribution, sustainability, education and training of the people, and of course, accessibility. Precision genomic medicine will have a transformative impact on personal health and well-being, with health economics and national productivity. The new area for health has started. We need to adapt to the new technology and use them as much as possible for the sake of the patients and of the people. Here, thank you very much for this opportunity to discuss about that, and I open to questions.
Thank you very much as well for the speech. Any delegate wishing to make a question, please raise your hands. Mr. Vantarakis, do you want yourself to say who will make the questions, or do you want us to regulate that?
Whatever, no, whatever it's better for you. I don't know. That's your choice. Yeah.
Okay, since there's only one in Poland, can you please open your microphone, make your question?
Thank you. I just want to ask the people that are over 70 on age. This is going to be very hard for them to use technology and try to communicate with the doctors and the people to help them if they're sick or have a disease. How can you answer for that?
Thank you for this question, because it's my main concern. As I'm working in public health lab, my main concern is that exactly what you said, how we are going to access, how we're going to give access to people who are, even they are very old, they don't know technologies, how we are going to make this accessible to them. There are several ways that we can do it. Of course, it will be difficult at the beginning, but for example, from the local doctor, doctor in this, for example, village, he can give him access to this person. But the main problem now, it's not the access of the old people. The problem is the access of the doctors of the remote areas, of the rural areas. There are doctors until today. When I say they need to be educated, I don't mean only the people, but I need the doctors as well. There are several doctors that they don't know to use telehealth, telemedicine. So firstly, we need to educate them to accept this new era of for health, because there are, I have to be honest, there are doctors, they don't like that. So first of all, they need to understand the necessity and of course the gains that we have from this use. This is a technology. We are only going to use the technology. It will not be the other way around. The technology will use us. So first of all, the doctors will learn, and then the doctors will help by their presence people who are very old, not only to learn, but of course to have access to these new technologies. And I believe that step by step it could be done. Of course, it would be better if we have it started from lower ages, but of course we need to give this happens, telemedicine happens for mainly the old people, so we have to wait to solve this problem. But the immediate solution could be through the doctors, the local doctors.
Thank you very much.
Iran, if you're recognized.
Apart from the elderly, there are also many countries that, because they might not have the financial ability to do so, they're not that evolved technologically. How is telemedicine going to help and benefit these countries?
You're doing very difficult questions. So that's really a main problem, not for us, for the global community. That means global community should share about this, your question, for example. We have health inequalities in global level. The health inequalities should be lower. One part of these health inequalities is the lack of the ability to use telemedicine. So they need to fund as they fund other things to poor countries. We need to fund them in order to use telemedicine. And if we fund them, we could help them not only to improve their health status in their population, but we may in sometimes have less cost at the future. At the beginning, maybe of course it costs a lot, but think about that. If we have better telemedicine, there will be no need for several doctors to travel from a country to country, so that help to lower the cost in general term. But at the beginning, of course, we need to fund. We need to give money to these countries in order to be adapted to this new telemedicine age. Another, can I comment something? Not in that, but in general for all of you.
Yes, yes, of course.
Very important thing is the bioethics. It's maybe one of the most difficult things. The cost, the money, maybe we find it some in either ways. But think about that. The information then will travel, and think how easy the information travels through social media. Think about the dangers that there are, that we are going to have access to information, personal medical information from people. That's why these platforms, this way of telemedicine should be very, very critically and very carefully organized in order to solve the GDPR problems, the problems of the people that may face that medical information from there can be transferred a lot to various platforms, etc. So we must be very, very careful on that, and this needs a lot of this needs time in order to solve these problems of confidentiality. Anything else?
Okay, Canada already had a question, so please give them recognized.
Thank you for the recognition. Since the appointments and the meetings with the doctors are going to be virtual, how can the patient be assured that the doctors are verified with the certification?
How the doctors are what?
Okay. How are the patients are going to be assured that the doctors are verified with the certification?
The doctors are very, very what? I didn't hear.
Are verified with the certification.
They look, usually these certifications are these platforms. They have certified systems. So we're not just. It's not just a platform. For example, now we have started with the electronic signature in university and in other bodies. So through that, we're going to have this certification that will be really digitally certified. There are ways to do that. Of course, it needs education. We need to educate the doctors and, of course, the patients, but mainly the doctors. So I believe that we need time. For telemedicine, of course, it's nice, but we need time. But I have seen that this new telemedicine to work, there is a unit now in Castellorizo. You know where is Castellorizo? There is a mental health unit that works remotely for mental health problems. So the psychologists, psychiatrists are in Athens, and they help people who are in Castellorizo. So think about that, how helpful could be that. Even, of course, we need to overcome some restrictions, some problems, but think the positive thing, that how many things we are going to gain following that process. Of course, I agree with you that the matter of certification is really important, and we need to ensure that we have the good quality of confidentiality, even in certificates.
Thank you.
And United Kingdom.
Thanks for the recognition. As you mentioned, for the virtual appointments, how can the doctors evaluate the patient's condition if they can't run the proper exams?
When you are talking about virtual appointments, doesn't mean that we lack the other appointments. Of course, if you, for example, visit a doctor, maybe you visit, if you have a disease, you may visit 10 times a year. So it will, you're gonna skip a few of these appointments, not all of them. We're not going to transfer directly to everything to telemedicine, but telemedicine could help the patient to avoid these 10 visits and goes for less visits to the doctor. That means, for example, the initial visit should be in the doctor, and then the doctor knows your situation, knows your health record, and then some of the next appointments could be virtual. But think about how many things we gain from that. This is, of course, it will not, we are not going to be very, very clear with that. We are not going to lose the, you know, the contact between doctors and patients, but it will be another way of contact.
There can only be one more question. So, Poland, you've been recognized.
Thank you for the recognition again. I want to ask how this technology can affect on the environment.
Very nice question. Yes, it can affect the environment. I didn't mention that because I'm trying to focus on the health information. Think that we are going to have less transportation. Mainly, we are going to have less transportation of the people that are traveling around, etc. So that's very important. Also, we are going to have travel information, and we are going to can educate the people with easier way. When the people start to understand the way that telemedicine works, telehealth works, they can be more, they can accept more information, and information that can be very important, even for the environment, their personal hygiene, for prevention. They may know how will be the prevention. So in various issues. So we are living in an area, in an era that we don't have so much telecommunication for, we have social media, but we don't have official telecommunication for scientific matters. So this transfer to telemedicine era will help us to transfer knowledge to a big amount of people. And these people will be learn about the environment, about how telemedicine can help the environment, how they're gonna change attitudes and beliefs about prevention, about risk assessment, and it will help them to their health as well.
Thank you.
Delegates, unfortunately, due to time constraints, we cannot allow any more questions because we are already very behind on schedule. So, Mr. Vantarakis, if you have anything else to say.
No, I'm really happy to be here. Thank you very much for your questions. It was really valuable, and I hope that you enjoyed this presentation.